Overview of managed care and Medicaid changes. Iowa HealthLink is now the name for the Iowa Medicaid Managed Care Program. Iowa is launching a new program effective April 1st called Iowa HealthLink. The original start date was January 1st, but the Federal Centers for Medicare and Medicaid Services delayed the launch until April 1st, 2016. The Iowa HealthLink program aims to bring together all services, such as physical health care, behavioral health care, and long-term care, under one program. The vast majority of current Medicaid patients will be provided care under this new program. Programs that will not be included in the Iowa HealthLink program are Program of All-Inclusive Care for the Elderly, or PACE, although they may opt in. Medicare Savings Program only. Medically needy. Undocumented persons eligible for short-term emergency services only. And presumptive eligibility. Medicaid will continue to provide dental benefits for pregnant women and children, and adults will continue to be covered through the Dental Wellness Plan. The HIP program, which is a premium assistance program offered through Medicaid, where members do not receive Medicaid services. A managed care organization, or MCO, is a health plan that coordinates care for a member. The MCO is a private entity, like other insurance companies, and is paid from the state of Iowa to coordinate the patient's care. In January, February, and March, Iowa Medicaid members will continue to receive services as they did previously. Members will receive coverage from Iowa Medicaid between January 1st and March 31st, 2016. Beginning April 1st, members will receive coverage from their chosen managed care organization, or MCO. All Hawkeye members were transferred to United Healthcare. 75% of Hawkeye members were participating in Wellmark in 2015. These members will have the opportunity to switch to AmeriGroup or AmeriHealth by selecting an MCO prior to February 17th for the April 1st start date, or they can decide to stay with United Healthcare. WellCare is no longer an option through Iowa HealthLink program. Members who were assigned to WellCare will be reassigned to one of the three MCOs and should have received a letter for reassignment. Members should ensure they have updated their address changes with the Department of Human Services and should watch their mail for MCO member enrollment letters, which include their MCO cards and primary care provider, or PCP, selections. Members wishing to confirm their MCO choice before receiving the MCO confirmation of coverage letter can do so by calling Iowa Medicaid Member Services. Members can also get assistance with their MCO selection. Iowa Medicaid Member Services will provide counseling on choosing an MCO for Medicaid members enrolled in the Iowa HealthLink Managed Care Program. Iowa Medicaid Member Services assists members by providing information about the MCOs and proposes items for members to consider when making the decision. It's important to note that choice counseling does not allow for Iowa Medicaid Member Services to make any kind of recommendation on which MCO should be selected. During January, February, and March, providers will bill Iowa Medicaid Enterprise through the fee-for-service model. Programs such as Meridian and Magellan are no longer effective after January 1st. After April 1st, providers should proceed with the new MCO pay codes. The Iowa HealthLink program is designed to bring all member services under one program. To achieve this, 3 managed care organizations have been named. They are AmeriGroup Iowa Incorporated, AmeriHealth Caritas Iowa Incorporated, and United Healthcare Plan of the River Valley Incorporated. Please note that WellCare is no longer an option as of December 18, 2015. MCOs are required to cover, at a minimum, all of the services that Iowa Medicaid currently covers. The benefits you were eligible for before Iowa HealthLink will stay the same after April 1st. What is unique is that each MCO company can offer value-added services, which are additional incentives that a member may receive by choosing that company. Members can contact the Managed Care Ombudsman for advocacy services at 866-236-1430 or via email at managedcareombudsman@iowa.gov. The Managed Care Ombudsman can provide assistance resolving a concern with your MCO or healthcare provider and can help members understand their rights and resources that are available to them, such as legal assistance and advocacy services. The Department of Human Services will continue to determine eligibility when a member applies, and the application process will stay the same. Members will continue to receive a Medicaid card once they are determined eligible for services. Applications are still available online, over the phone, and on paper. Any questions can be directed to Iowa Medicaid Member Services, toll-free at 1-800-338-8366 or 515-256-4606 via their website, iahealthlink.gov, or via email at imemembersservices@dhs.state.ia.us. What is the correct date for how long members can see providers outside of the MCO network and receive 100% reimbursement, and then 90% reimbursement? As of April 1st, 2016, all out-of-network providers will receive 90% reimbursement rates indefinitely. The 90% out-of-network rate applies to out-of-state providers as well. If the MCO and the provider came to a single case agreement, the MCO may pay more. If a member's Medicaid provider is not included in their MCO's network, will the provider be paid? Can the member be forced to pay out of pocket? The member will never be forced to pay out of pocket for a Medicaid provider. The provider may accept the 90% out-of-network rate from the MCO or refuse to see the patient. The state will not pay if the member has been assigned to an MCO. The provider may accept the 90% out-of-network rate from the member's MCO or refuse to see the member. A provider who knowingly treats a Medicaid member cannot bill the member for the rate differences of services rendered. If a Medicaid provider refuses to accept the out-of-network rate, they cannot bill the patient directly. Can patients be billed from providers who are not participating with the MCOs or Medicaid? Yes. The provider must notify the member that they will pay out of pocket prior to services, or the provider may refuse to see the patient. Members will be auto-assigned to an MCO. Members had until February 17, 2016 to select their MCO to go into effect April 1st. Members also have until June 16th to change their MCO for any reason. After June 16th, patients will need good cause. An example of good cause is if a patient's provider is not enrolled with an MCO. Please note that, depending on when the member switches, it may take more than a month or more for the change to go into effect. Iowa Health and Wellness Plan members still need to finish their healthy behaviors. Getting a wellness exam or dental exam is the first of many health services that make sure you get the care you need. Remember, Iowa Health and Wellness Plan members who complete healthy behavior requirements each year will not be charged a monthly contribution the following year. There are several ways you can learn more about Medicaid program changes. Contact information for email alerts about Medicaid modernization and the Iowa HealthLink website are shown here. What follows are 8 questions to test your understanding of the presentation so far. True or false? Lifelong Links is the name of the new program launching April 1st. False. The name of the program launching April 1st is Iowa HealthLink. True or false? HIP program members will be included in the changes to managed care. False. HIP program members will not be included in the changes to managed care. True or false? Hawkeye members will be included in the changes to managed care. This statement is true. Hawkeye members will be included in the changes to managed care. True or false? The MCO is operated by the state of Iowa. False. The MCO is operated by a private entity, like other insurance companies. True or false? WellCare is one of the managed care organizations. This is false. WellCare is not participating in the managed care program. True or false? Benefits will stay the same under the managed care model. This statement is true. Benefits will stay the same under the managed care model. True or false? DHS will continue to manage Medicaid applications and determine eligibility. This statement is true. DHS will continue to manage Medicaid applications and determine eligibility. True or false? Once assigned, patients are not able to change MCOs. False. Patients will have the opportunity to change MCOs. There are several key factors that members should consider when selecting their MCO. Are their providers part of the MCO network? Are their pharmacies part of the MCO network? Are there healthcare specialists part of the MCO network? Does the MCO have any value-added services or health programs that are beneficial? Does the MCO have member support available to fit their needs? In other words, 24/7 call center, language support, etc. Iowa Medicaid Member Services assists members by providing information about the MCOs and proposes items for members to consider when making their decision. It's important to note that choice counseling does not allow for Iowa Medicaid Member Services to make any kind of recommendation on which MCO should be selected. Materials have been developed to help frontline staff direct members through the transition to managed care. The primary care provider handout will be discussed later in this presentation. The member sample card handout can be used to show members what each of the MCO cards looks like and help them know what to look for in the mail. It also has important phone numbers on the back for Iowa Medicaid Member Services, Managed Care Ombudsman's Office, and the MCOs. Steps included on the handout provide guidance on where to call, depending on the member's need. The Provider Sample Card handout indicates where to find the Medicaid ID number and the MCO ID number. It also indicates where to look to determine if a member is enrolled in Hawkeye. Members who are not enrolled in Hawkeye will have an Iowa Health Link logo instead of the Iowa Hawkeye logo on their MCO card. There are MCO provider contact numbers included on the handout as well for quick access to support. The examples to follow offer some suggestions for assisting patients through the transition. The last example includes a face-to-face encounter where the member sample card handout can be used to assist the patient.
Good morning. Thank you for calling the doctor today. How can I help you?
I keep hearing about Medicaid changing, and I want to make sure I still have coverage to come see the doctor.
Well, thank you for calling. We appreciate that you thought to call us. You are not alone with your questions. This has been a confusing time with the recent changes being made to the Medicaid program. The first question I have is, are you part of the HIP program?
Yes, I am.
Okay, great. You don't have to do anything at this time because the HIP program was not included in the Medicaid changes. Your coverage and benefits are not changing. Thank you for calling the doctor's office. How can I help you?
Hi, I keep hearing about Medicaid changing, and I want to make sure I still have coverage to come see the doctor.
Well, thank you for calling. We appreciate that you thought to call us. You are not alone with your questions. This has been a confusing time with the recent changes being made to the Medicaid program. The first question I have is, are you part of the HIP program?
No, I've never heard of that program. I am pretty sure I have Medicaid.
Okay. Have you received anything in the mail? Enrollment packets have already been mailed to members.
But I didn't get anything in the mail.
All right, that's okay. I think the best thing for you to do is to call the Iowa Medicaid Member Services right away at 1-800-338-8366 and ask about which MCO would be best for you. They can tell you which MCO you are assigned to, and if that isn't the best choice for you, they can assist you in making a change. If it is important for you to continue to see your regular doctor, who you go to the most, you want to make sure that your doctor participates or is in network for the MCO you choose. It has been kind of a busy time, so if you receive a busy signal, just try to call again. A representative will guide you through the process.
Okay, I think I can try to do that today. So after I pick my managed care organization, my doctor appointments will be covered?
If you want to continue to receive care here, we are participating with MCOX and MCOY.
Okay, I really like seeing my doctor, and I want to make sure I can keep coming for appointments.
Okay, is there anything else I can help you with?
No, that's all. Thank you so much for the information.
Thank you. Bye-bye.
Hi, I heard I need to make a change to my Medicaid, and I need to know which plan to pick.
Okay, we can't say which organization is best for you, but each managed care organization provides the same benefits because they must provide the same benefits that you receive from Medicaid. Have you received anything in the mail regarding your Medicaid coverage?
No, I haven't, and I'm not sure who I'm signed up with either.
Okay, I can look on my system to see your MCO assignment. And I have a handout that can assist you through the rest of the process. I see here you are assigned to this one. The card that you get in the mail will look like this. On the back page, you will see the steps you can take to get an MCO card sent to you in the mail. If you want to change your MCO, the phone number to call is also listed.
Why would I want to change my MCO? Aren't they all the same?
The benefits should be the same, but you will want to make sure your providers are part of your MCO network. There might also be some value-added services. These are perks and special programming that you can receive when participating with the MCO.
Okay, that is a lot to consider. I'm not sure if I know enough to make this decision by myself.
I can understand. What I can tell you is that our office is in-network to the MCO you've been assigned to, so you will be able to continue to see the doctor here. We also participate in this one here.
So if I want to continue coming to see you, I need to go with one of these here?
Yes, that is correct. You might want to consider calling Iowa Medicaid Member Services for some choice counseling. They can help walk you through the process of things to consider in selecting an MCO. The number is on the back side of your sheet, right here.
Okay, that helps. I still feel confused, but it sounds like I have a better idea of the MCOs I need to look at if I want to keep seeing you.
This is a big change, and it is very normal to feel confused. Is there anything else I can help you with today?
No, I'm going to see the doctor today, but I do think I will call to get more information, and I need to call about getting my card. Thank you so much for helping me.
You're welcome.
Guidelines for providers. All healthcare providers delivering services to Iowa's Medicaid population, who are included in the Iowa HealthLink transition to managed care, are welcome to inform their patients of the Iowa HealthLink plans in which they have chosen to participate. However, there are strict prohibitions against patient steering, which all providers must observe. Guidelines for providers. Providers may not recommend one health plan over another and may not offer patients an incentive for selecting one health plan over another. Providers may not assist a patient in the selection of a specific health plan. Additionally, patients may not use the provider's fax machine, office phone, computer, etc. to make such a selection. Under no circumstances is a provider allowed to change a member's health plan for him or her or request a health plan reassignment on a member's behalf. Members who need assistance with their health plan selection should contact Iowa Medicaid Member Services. Welcome packets, mailed prior to April 1st, will include member cards and a welcome letter. An additional packet will follow that includes the member handbook and additional member materials. Members will be auto-assigned to a PCP, and this can be found on the front of their MCO card. Members should be aware of their PCP assignment. Members can make a change in their PCP to another provider as needed. Use the handout entitled, "What I Need to Know," to assist members in understanding the important role of the PCP under managed care. Checking insurance IDs. Each patient receiving Medicaid will present two IDs, the MCO identification card and the Medicaid identification card. Checking eligibility on the IME website. Eligibility and the patient's MCO will be indicated on the IME website. The IME website will not provide the patient's MCO identification number. Checking eligibility and ensuring PCP. Each MCO has a provider contact number to call to ensure eligibility and ensure the primary care physician. The following slides provide general information and key contact information for AmeriGroup. This information is also available in a handout format in the materials that are provided with this presentation. The following slides provide general information and key contact information for AmeriHealth Caritas. This information is also available in a handout format in the materials that are provided with this presentation. The following slides provide general information and key contact information for United Healthcare. This information is also available in a handout format in the materials that are provided with this presentation. What follows are 5 questions to test your knowledge of the second half of this presentation. True or false? Patients need to bring only their Medicaid card to their appointments. False. Patients should bring both their Medicaid card and their MCO card to their appointments. True or false? The IME website will indicate eligibility. True. As in the past, the IME website will indicate Medicaid eligibility. True or false? The IME website will not provide the patient's MCO identification number. The statement is true. The IME website will not provide the patient's MCO identification number. However, it will list the name of the MCO. True or false? Patients may be told which MCO they should pick by a case manager, provider, or other healthcare staff. This statement is false. Patients may not be directed by providers, case managers, or other healthcare staff which MCO they should choose. True or false? Patients who have not received an MCO card are not able to receive care. This statement is false. Patients should not be turned away because they don't have their card. A better option would be to use the member sample card handout sheet to show patients how to contact their MCOs if they don't have a card. Special thanks to the member organizations in the Medicaid Modernization Stakeholder Group, with funding from the Community Foundation of Greater Des Moines and Mid-Iowa Health Foundation.